So I'm going to present a case, Miss Kelly, and that's not her real name. So Kelly is a 56-year-old female postmenopausal. She came to me with a complaint of being addicted to sugar, and she said that she's been off it for several weeks. She said, I'm also addicted to carbs, can eat a whole roll of Toll House cookies or crackers at night. She had a history of alcoholism in the past, but the last use was more than 20 years ago. She weighs about 160 pounds, 5'4", so a BMI of 27. And she was given different medications. She's on methylphenidate, and then two, which is a stimulant, and then two antidepressants, duloxetine and bupropion. And she says that the methylphenidate allows her not to shut down as much and gives her energy. And the two antidepressants helps her control her anger and emotions. So besides the above chief complaints, she also says that she has depression, anxiety, poor concentration, lack of motivation, and migraine headaches. Her social history is that she's single, never married, no children, and she does not work at the moment. She does not have a good relationship with the family, and she's stressed because she's living with her father to be of support after her mother died recently. In terms of lifestyle, she says that she exercises 2 to 3 days a week with a trainer on Zoom. Her diet is mostly plant-based. She skips breakfast. She eats lunch occasionally with leftovers. Her dinner is with tofu, faux meat, legumes. But her most favorite thing to do is to have cheese and crackers, dates, peanuts, prunes, cookies, crackers in bed at night. She also snacks with fruit, almonds, tea and banana throughout the day. She feels that her sleep is not as good because she uses a phone in bed and she eats late at night. So she doesn't have much fun in life because she's living with her dad far away from where she used to live. Her support system right now is a therapist, and she sees this therapist because of binging on sugar is basically an addiction, just like cocaine, heroin, any other addictions that you may have. And excessive sugar use will lead to an addiction. And this is the pathway that I showed you yesterday, where addiction involves many different kinds of neurotransmitters and different areas of the brain. But essentially, addiction is a dysfunction of the reward pathway that ends up in dopamine in the nucleus accumbens. So it's a combination of genetics. You may have less receptors, or you may have epigenetic issues from your mother or from past generations, and then your environment, maybe not having enough of a good diet, eating too much processed food. So those two together may cause you to have less of these dopamine receptors or any of these other neurotransmitters that are depleted. So this is my framework for when I treat addictions. So I think we need to address all the 4 steps: the biological, the psychological, the social, and spiritual. But I start with the biology and physiology. I think that if we can correct that, at least partially, then the patient can pay attention to the psychosocial, spiritual aspects of recovery. So with the biological aspects, I try to give them nutrients, medications, a good diet. I do a lot of testing, and then lifestyle interventions. So in terms of the kind of work that this patient needs to do, from her psychological point of view, she's had a history of trauma in the past, and then she's had a recent trauma with her mother's death, and now she's separated from her usual environment. So those are all areas that she might need to address. And social, again, she doesn't have much of a network. Her social network is basically people that she pays, and people from like the Overeaters Anonymous. So she doesn't have many friends. And you wonder if she has a purpose, like she's not working and she's now just hanging out with her dad. So these are things that you would uncover over the long-term relationship with someone. You don't have to uncover everything right away. So if you correct the biology, that's what I concentrate on. It seems like over time, you can address all of these other issues. So her goals with me was that she wanted to lose weight and wanted to get to overall better health. And she expressed a desire to cut down on the medications she was taking. And as I mentioned yesterday, I administer a lot of questionnaires before the patients come in to see me. With her particularly, we're going to discuss the food cravers questionnaire and the 1 to 3 day food diary. And I check the adverse childhood experience ACEs questionnaire with everyone because addictions and ACEs are intimately tied. But I don't really address it. I just gather the information and then I wait until another moment when it's a good moment for the patient to really delve into it. And I don't do it myself. I usually refer them out. This is a food cravers questionnaire that you can find from Julia Ross's website and in her book, The Craving Cure. This is adapted. She has a much longer questionnaire. I just chose a few questions from each of the sections. And basically, the questions pertain to certain neurotransmitter depletions. So if the patient says that they eat to feel happy in the late afternoon, then you may consider that low serotonin is their issue. This is part of the reward pathway. And then if they say that they're eating to get some energy boost, you might think that catecholamines are depleted. Or if they're eating sugar and carbs, when they feel overwhelmed, then you might think a GABA repletion might help them. Or if they eat sugar because they feel like they deserve a reward, so then endorphin depletion might be an issue. And then if they eat because they have, or if they crave sugar or food because they haven't eaten in a while, then you would think that perhaps it's the low blood sugar that's causing them to overeat or overeat sugar in particular. This is the amino acid chart that I discussed yesterday. Again, you can find this in Julia Ross's books, The Mood Cure, Craving Cure, and The Diet Cure. And she actually discusses this questionnaire in detail, and you can do it yourself, or your patients can look at the book and they can also do it themselves. But in my opinion, this is complicated enough that it's best to get some training. And the training is usually either with Julia Ross. She does some training. And I took the training with Christina Veselak. That's the aminoacidtherapy.com. And basically, this questionnaire maps out to neurotransmitter depletions. That's serotonin, endorphins, GABA, and catecholamines, and also low blood sugar. So with low serotonin, you may have certain symptoms. And then what you do is you ask the patients what are the substances they used and craved to take care of those symptoms. And then you replete them with certain amino acids. And then you expect certain results from the amino acids, and that's column D. So you would go through this with each patient, and then you can do this every day, every other day, every week, and you can determine the frequency of re-administering this questionnaire. And yesterday I showed you that there's a lot of data to back up this kind of intervention where you're focusing on neurotransmitter depletions as a way of addressing some of the reward pathway issues. And if you refer to yesterday afternoon's slide and lecture, you'll get a lot more of the literature backing this kind of intervention. This is Kelly's amino acid chart. And so she, as you can see, it's actually very small for you to see, but she had a lot of 8s and 9s in some of the areas. And so what I did was I took it out so that you can see it better. And here you can see low catecholamines. She had numbers of 8 and 9s. So then I thought, okay, and I asked her, of all the areas that could be addressed, which one would you focus on? And so we talked about catecholamines because she just doesn't have energy when she wakes up in the morning. So I said, okay, let's see if we can boost up your dopamine. So what you would do is the amino acid trialing, which is giving the amino acid while you're sitting with the patient, maybe 500 milligrams of tyrosine or less, and then waiting 10 minutes, putting your stopwatch on, and then seeing how they do. And you could repeat that 2 or 3 times during your 1-hour session with them. My first session is usually an hour and a half to 2 hours, so I do this with them. And so she also had low blood sugar, which is understandable because she had a sugar addiction, right? So she had low blood sugar. And so you would recommend a diet that's high in protein, low carb. And then glutamine is really good for curbing some of these cravings. And this is the paper that sort of says that glutamine really helps with some of the energy that's needed. And so, especially for the prefrontal cortex that we talked about yesterday. So you can give her glutamine on a standing basis, meaning 2 or 3 times a day, and then as a patient has cravings. So this is what we were talking about, just mapping out the depletions that a patient may have using the amino acid chart. And then these are the amino acids that you would give them to see if we can replete them. And so this is a quick win. You would have the patient feeling better in 10 to 15 minutes. So this is a good thing to do in your visit with the patient. Or they can do it themselves, actually. You can train the patient to do the trialing themselves. So we talked about this issue yesterday with addictions. Hypoglycemia is pervasive. So, and you need to have energy to be able to say no to whatever drug of choice or food of choice that you may have. So addressing low blood sugar is key if you don't want relapse. And you can refer to yesterday's slides for that. And here we have a pro-recovery diet. This was created by Patty Reese. And it basically says you have to eat breakfast, a high protein, high fat breakfast. And then throughout the day, every 3 or 4 hours, you have to eat a high protein meal. This keeps your sugar levels steady, so you're not having these highs and lows, and you're fueling your body and brain. And so when I saw the patient, this is the diet I recommended, the pro-recovery diet, asking her to eat a breakfast and then eating throughout the day. I suggested all of these supplements, but she actually didn't take any, and she was a little reluctant by the end of the visit to even start them. The other thing that you can do with patients is something called food mood diary. So what they do is they write down all the foods, every single thing that they eat during the day, and they write down the moods also and the time of the day with the particular moods. So then over time, they can relate their mood to the kinds of food they ate. So this way they understand that there's a link between their moods and the foods. So that's why this is called the food mood diary. And you can get this. I got this from the course that I did with Christina Veselak, the aminoacidtherapy.com. This is a great book, awesome book to use for you, your patients, your friends and neighbors. And she has Julie Ross. This is a Julie Ross book. She has 3 books. This is the last one. And she talks about, she gives the amino acid, she has the craving questionnaire here, but it's basically like the amino acid chart, but she tailored it to food and sugar and carb addiction. So for this patient, her lab results came back. So she had a triglyceride to HDL ratio of 3. The ideal is 1. So this shows that she's eating a lot of carbs because the carbs are converting to triglycerides. She has inflammation. Her CRP is 2.2. She has low B12. I usually like to see a B12 around 1,000. Her vitamin D is lowish. Usually 30 to 35 is what I aim for. 40, 45, somewhere a bit higher than 25. So her omega check was 4.4. I usually aim for 8. Her insulin was a little bit on the higher side, so it's 9. I usually like to see it 5 or below. A1C is pretty good, and her fasting glucose seems to be good. So from this, you cannot predict that she has hypoglycemia. As I said yesterday, to really see if someone has hypoglycemia, you need to do a very long glucose tolerance test, like a 5 to 6 hour glucose tolerance test. We just don't do it anymore, and I don't do it either. We just recommend the pro-recovery diet and really stick to that. And so, as I said, she wasn't great at taking her supplements, and she didn't really come back for follow-up for a few months. And then when she did come back, she said she wasn't ready for any changes. She wasn't taking any supplements. She wasn't consistent with her meals. She was still binging. And so we started all over again, just recommending something simple. I said, how about just eating breakfast? And then we waited for other lab tests. But she had all of these supplements. I went through her labs. That is a motivating element for patients. If you can show them the labs, they may be inclined to taking supplements, but for her, it did not work. So she didn't take any supplements, actually. Then these are the test results that came back. It showed that she had a significant omega imbalance. She has oxidative stress, and then she needed some detoxification. So when you actually looked at the results in detail, they detail what kind of antioxidants to give the patients and the kind of B vitamins, and she needed all of them, and then minerals, and then they recommended 2 grams of omega-3 fatty acids and some digestive support. So in terms of the gut microbiome, it actually looked pretty good. So this looks great. And then this showed that she had low commensals. And I think Dr. Zawicki mentioned the low Bacteroides as indicating perhaps a low vitamin D, I think, if I remember correctly. And so she had low commensals. And here, just a little bit of high streptococcus, but this is one of the best gut microbiome tests that I've seen. And all of this looked pretty good. She just has a low secretory IgA that you really need to boost up. So she would be able to fight off any infections that she would get. And this is, again, we may not think of sugar as an addiction, but it is an addiction. It might not be that they go to jail or that they have the same consequences as, say, alcohol use disorder or an opioid use disorder. But people who are not eating well or who have eating a lot of sugar, they're prone to getting metabolic diseases. So you really want to get them out of that particular kind of addiction, because otherwise they have shortened lifespan, right? Or a shortened health span. And these are all the different factors that you would need to address over some period of time so that you can get them to optimal health, so that you can get them to a 5-year recovery. So if you address each one of these, and I know you can't see them, but perhaps in your slide, but there are many, many things you can address and uncover. And again, these are the 4 steps to optimal recovery. And so I address usually the biological, as I said before. And so thank you for having me. And